Rupa ma'am, can you hear me? Hello.
Hello.
Yes, ma'am. You can share the screen.
I can share the screen. Okay. I'll sit 1 minute.
Okay, okay.
You have to share the screen. How do I do that? Here it is.
Yeah.
हाँ. Deepu. Hello.
Yes, ma'am. Yes, yes.
Yeah. I have to share the screen.
Yeah.
Then it says that this screen.
Yeah, yeah.
Jigna. I'm kada nera ta sami dikha jine adu no dikha je. Na. Deepu. Hello.
Yeah, yeah.
Dr.
Yes,
Deepu, can
ma'am.
you see the
We
screen?
will start in 2 minutes.
No,
Okay.
but can you see the screen?
Yeah, yeah. I can see the screen perfectly.
Okay, right. Thank you.
Okay.
Priyanka, next slide में. मेरे जो कड़ा है ग्रीन बटन सामने के हटा सीधो के कड़ा. Did I book it? This is correct. But I do. I don't have to look late.
Ma'am, just 3 minutes, okay?
Yes.
Okay, ma'am. Can we start the session, ma'am?
Yes.
Okay. So, good afternoon, one and all. Welcome everyone to yet another session of Excel series, the weekend program. So, before we start the session, let's have a silent prayer. Thank you all. So, today as a faculty, we have Dr. Rupa Kothari, and the topic is on integrated oncology. So, I would like to introduce our faculty of the day. So, Dr. Rupa Kothari graduated from CMPH University of Bombay, and she has a clinical experience in various institutions like uh, Mulan Municipal Hospital, Mumbai Devi Homeopathy Hospital, Mehta's Clinic, Dr. Ramesh Bilinga, radiation oncologist, Bangalore Institute of Oncology, and currently she's the founder of Dr. Rupa Kothari Homeopathy Clinic, and she has presented various papers on quantitative evaluation of homeopathic therapy in cancer on 1996, a National Conference of Homeopathy, Bangalore, India. Then scope of homeopathic therapy in cancer, 2001, role of therapies in cancer management and treatment, National Seminar, Hyderabad in India. Homeopathic treatment of cancer, the third International Conference on Integrative Oncology, 2018, Nashik, Maharashtra. A chart presentation at the 6th Congress at the Liga Medicorum Homeopathica International held in Berlin, Germany, 2005. Then homeopathic treatment of cancer, the second World Congress on Homeopathy and Traditional Medicine, Serum Molecule to Macromolecules, Thailand in 2019. So we have a reputed faculty who is very much fond of cancer. And welcome, ma'am. You can start the session. Welcome, ma'am. You can start the session.
Thank you so much, Dr. Deepu. Thank you so much. I'd like to thank the IHMA to give me this opportunity to share my understanding of oncology with you. Today, I'm going to talk on integrated oncology. This is a part of oncology. Oncology means the study of cancer, abnormal, harmful, uncontrolled multiplication of the cells, forming a local hard mass, also spreading via blood to distant organs. That study of cancer, in that there is one branch which is a now upcoming branch. We call it integrated oncology. Herewith, I will give you my understanding of what integrated oncology means. So, integrated oncology is a branch of cancer where the approach used is to only care for the cancer patients. It is a patient-centric treatment, not disease-centric. Please understand. We have to just see to it that the patient is comfortable. It could be in any stage of cancer. It could be by various systems joining hands and helping the patient, giving the support to the patient to fight this dreadful illness which they are diagnosed of, where the word itself gives a fear of death. And this is common to all cancer patients. The moment the biopsy report comes, the moment you are labeled as cancer, the anxiety, the fear, the emotional balance is lost, not only of the patient, but also of the near and dear ones, the family of the patient. So this branch will allow us to make the patient sail through this journey easily. We have to hold the hands of the patient and their relatives and walk with them with all whatever treatment is advised to them, whether they respond, they don't respond, whether it is terminal, whether it is curative. But we have to be available for them to make them walk through this path, either towards cure or towards death. Now, what are the requirements that we need to practice integrated oncology? We have to be extremely equipped with knowledge. Knowledge of the disease, that when a patient comes to you with certain reports of cancer, what does it mean? What is the type of cancer? Is it aggressive? Is it less aggressive? Is it stage 0 or is it stage 4? Is it going to be completely curable with the conventional line of treatment like surgery, or does it need any further treatment? And investigations. We have to be competent enough. Every single day, we have to upgrade our knowledge of the treatment available in other system of medicines which are beneficial to the patient. What is the extent of benefit those treatment do to the patients? Also, what are the latest investigations? When I entered oncology, we had, for example, in CA breast, we did not have much of an immunohistochemistry reports, which tell us that whether the hormones in the body affect the growth of cancer or spread of cancer. That is the time estrogen and progesterone receptor, ERPR, were just found out, and medicines were not available. Initially, they used to remove the ovaries, then the medicines were available. Now they have gone to such high level of testing the type of tumor that they have to tell us the prognosis, the result of the treatment which is going to be given. Will it be curative or not? So we have to upgrade ourselves. What are the latest investigations? What is a PET scan? What is the difference between MRI and a PET? What is when a PET should be done, when a sonography should be done, when a CT scan should be done? Along with the disease of the knowledge of disease, that is cancer, knowledge of the various treatments available, and various new investigations, technology, a very sound knowledge of homeopathy is required. That is our weapon. Knowledge of homeopathy. All this combined, we will be able to help the patient to overcome cancer. So what are the departments of integrated oncology? What are the various stages where, or various departments where we can help the patient? Now we can help the patient to receive the prescribed treatment, which could be surgery, radiation, chemotherapy, and hormonal therapy. This is, we are with them during the treatment that they are receiving for cancer. Then we can also help those patients who have received this treatment already. They are into no cancer state, that is called remission. Today I do not have cancer. I had cancer, I took radiation, I took chemotherapy, I did my surgery. Now my doctor says you're cancer free, just keep reporting for the next 5 years. Remission. After 5 years, we say cure. So when they are in this remission stage, they still do have some side effects of the treatment taken. Like with radiation, it could be skin burning or thickened skin, indurated skin, or colored skin, dark colored skin, corrugated, rough skin. With chemotherapy, it could be the neuralgias that remain for a very long time, the numbness of the extremities that remain for a very long time. Post-surgery, there could be again neuralgias that remain, or the pain that remain. And with hormonal treatment also, there could be some side effects, which we can give medicines, counsel the patient, and help them lead a better quality of life. And last is the incurable cancer patients, where the disease either has reoccurred after doing the advised line of treatment and no further treatment can be done, or they are diagnosed in stage 4 or an advanced stage where no treatment is going to help. So these patients definitely need integrated oncology as a part of their life. We need to be with them to help them and their near and dear ones, the spouses, the children, the family members, to make them understand that how day-to-day care can be taken for the patient. Need not look at the survival, at how long will he survive. As far as my patient is happy today, able to lead a comfortable life today, we have won the race till today. So in these 3 departments, I'll be further talking how we can help as homeopaths. So integrated oncology, what is the plan of treatment? Always patient-centered treatment, not disease-centered. don't go on the type of disease, name of disease, is always patient-centered treatment. Support your patients. How can we support our patients? First, mind and body symptoms. Both have to go hand in hand. The body is improving, mind cannot go bad, and vice versa. So here comes the role of medicine, knowledge of medicine, where we will take the symptoms, give the indicated remedy, and give relief to the patients. It is very, very important here that along with the reports, the investigations, we also listen to the patient, hear them out. What are their anxieties? What are their fears? Listen to the relatives of the patient, how they can be helped in taking care of the patient. All this will come in the first part, mind and body symptoms. Lifestyle modification. Here, we have to guide them as to if you have a gastric carcinoma, stomach cancer, which is, we know most of the time, it is ulcerative, edematous, thickened wall of the stomach. So we'll have to guide them. Do not eat chilies, no red chilies, no green chilies, no black pepper. Do not have alcohol. Do not smoke. Eat freshly cooked food. Avoid tinned food. Avoid preservatives. Avoid packet food. Avoid bottled drinks. We should also advise them post chemotherapy, they have to be on a high protein diet, like take lots of protein in terms, if you're a vegetarian, dals and paneer, milk, curds. If you are a non-vegetarian, you can have eggs as well. Nutritional support and lifestyle modification, I have combined and told you so. Other than that, we have to insist them that they exercise regularly, even if however weak, 10 minutes, 15 minutes, or just pranayams, just yoga. If you've been operated for a particular cancer, physiotherapy to that part is very, very important. Example, you've had a mastectomy, breast removal surgery for cancer. And along with that, they would have removed the lymph nodes, axillary lymph nodes. So what I fear is over a period of time, that arm on the side of which the surgery has taken, example, right breast has been removed, then the right arm will develop lymphedema. So we need to personally teach the patient how to do the exercises, how to do the milking of the arm, how to raise the arm every day, sleep for 20 minutes with the arm raised on a pillow, so that all the lymph that is left in the arm, which has not been cleared as there are no lymph nodes, comes down into the body due to gravity and exercises. All this is very important. Otherwise, cancer is cured. For example, CA breast, I told you right breast, operated, right lymphedema. But the right hand over a period of 5-7 years, right whole upper extremity will become so much edematous. Then there are problems with social acceptance, pain in the shoulder, pain in the nape of the neck. So this then remains for lifelong. So it's very, very important for us to deal at each and every level. Lifestyle modification also includes things like 7 hours good sleep. We'll have to tell them not to read also too much about cancer. That creates a negativity. Good food also means have lots of fruits, salads, vegetables. So spending time with the patient to explain them all this is very, very important. In fact, there are departments in certain hospitals which give out ragi, that is nachni, which has highest iron, calcium, and potassium packets to go and prepare food from this, so that it gives strength to the patient receiving chemotherapy and radiation, so that they are able to receive the treatment on regular intervals instead of delaying the treatment because of weakness. Now I will come to the first part, mind and body, symptoms. That is where our knowledge of science, medicine, homeopathy helps. The role of homeopathy starts from the very beginning. Initially, in my first 10 years, decade of practice, I used to have patients either as incurable cancer patients or patients who would come to me after receiving all the therapies. And then, but recently, last 5 to 7 years or 10 years maybe, I have patients coming to me telling me, I have got this hard mass, hard lump or ulcer in the mouth. Please check me. That's the time I begin to start the treatment, pre-diagnosis. We have to encourage the patient to go for investigations so that our diagnosis is very clear. It could be a mammography, it could be X-ray mammography, it could be biopsy, it could be CT scan, it could be an ultrasound. Be with the patient, tell them, and earlier the diagnosis, better the treatment. And in fact, if we investigate and it is negative, we have no stress. So it has to be communicated very well to the patient and the relatives. From then on, I also take the symptoms and give the indicated remedy. Not for long, till I give them time, do the investigation in next 2 days, 1 week, and come back to me. Here, I also go to the extent that if I found a lump in the breast, and according to me, it is a hard, immovable mass, almost indicating cancer, so they would prefer probably a second opinion. Do not worry. Patient trusts you. That is why they have come to you. Send them for a second opinion to an oncologist. Tell them, communicate with them, communicate with the doctor they are going to. Tell them, let him also examine you and let me know what he thinks. If you are a good doctor, if your knowledge of medicine is correct, diagnosis won't differ. After the diagnosis or the investigations, then comes the biopsy. Cancer is proved only by biopsy. Unless there is a microscopic report, histopathological report, seeing the cells are cancerous, we cannot confirm cancer. So post-biopsy, if they are posted for a biopsy tomorrow or day after, I tell them after the biopsy, take this medicine. Those are my healing medicine, which heals the tissue which has torn or injected or cut and the blood is oozed out. So not only the medicine will heal that injured part of the body and also will help to prevent the lymphovascular spread. So the fear after biopsy, the disease spreads or does not spread. But if given homeopathy, it definitely helps in healing the wound and not spreading of the disease. So that's where homeopathy should be given post-biopsy, because the report of the biopsy also takes minimum of 72 hours to maximum 5 days to come. Till then, the patient should be given some medicine to heal the stitches, the biopsy area. After which, now I will talk about homeopathy along with other therapies that are prescribed. How homeopathy can be given hand in hand with surgery, chemotherapy, radiation, hormonal therapy, and in incurable cancers. So let me start with chemotherapy first. What is chemotherapy? Suppose you have diagnosis of lymphoma, that is cancer of the lymph nodes. It could be at one part of the body, just cervical, or we can have lymphoma which is there throughout the body, from cervical to thoracic to intra-abdominal area. There are times that we find such lymphomas in organs as well, which is brain and breast. So when the first line of treatment, there is not surgery, it is chemotherapy. So when the patient is posted for a chemotherapy, you give the medicine which will cover the side effects of chemotherapy. As soon as the patient receives the chemotherapy, I ask them to report me their complaints. And trust me, every chemotherapy can give different side effects. The same drug of chemo. So there are 6 times the chemo has to be taken every 21 days. The patient usually tolerates the first and the second chemotherapy well. But the
The
side,
slides are the role of homeopathy, right?
yeah,
Okay. Okay.
okay. So I'm here at the chemotherapy. Okay.
Yes.
So, when you give the first, second chemotherapy, the side effects are not many. From the third or the fourth chemotherapy, the side effects are many. Or many patients are very sensitive, so they start reacting from the very first chemotherapy. So it depends upon individual patients and individual drug administered. You have to decide the drug which will help them. Most common side effects of chemotherapy. It's going to be fever, which we call it as febrile neutropenia, because once you give the chemotherapy, it destroys the cancer cells, along with which it also destroys the RBC, the WBC, the platelets, and a part of bone marrow. So they develop fever because they are easily prone to infection. The second side effect of chemotherapy, most common side effect, is nausea, digestion problems like cramps in the abdomen, diarrheas. They have burning sensation in their extremities. For all this, we have wonderful remedies, which whatever the patient complains, you choose the indicated remedy and administer it till that complaint is there. Once they get better, stop it. Wait for them to take the next chemotherapy. Ask them the symptoms. How are you this time? And then start helping them. There are times where the patient may tell, every chemotherapy, during the therapy, I develop fever. So give them medicines indicated. If the fever is with chills, without chills, usually arsenic helps, apis helps, rustox helps. So you'll have to understand the nature of reaction the chemotherapy gives to a patient and give the medicine accordingly. After chemotherapy, the other standard line of treatment in conventional method is radiation. Now in radiation is giving local radiation by various methods, which is external beam radiation, and there is internal radiation, which we call it brachytherapy. Radiation also has a lot of side effects. The highest cancer in Indian women is cervix cancer. And the line of treatment is always radiation. Chemotherapy does not work in most of the times does not work in cancer of cervix unless given a concurrent small tablet to be swallowed so that the radiation affects better. The side effect of radiation, I'll take example of CA cervix, is redness of the vagina, which call it vaginitis, redness of the anal area, bleeding from the vagina, bleeding from the anal area, foul smelling discharges from the vagina, pain in the suprapubic, lower abdominal area. There could be edema of the legs, lymphedema. All this, various homeopathic remedies. For example, if you have burning, cystitis is also one of the common side effect of radiation, burning urination, urethritis. So we can think of remedies like cantharis, like apis, like creosote, like aloe. In this, if you give it, they are able to complete. Usually radiation is given for few minutes every day for minimum of 4 weeks to maximum of 6 weeks. So we will be able to make the patient take or accept or receive the radiation well. Then comes hormonal therapy. In hormonal therapy, the most common area is one in CA breast, and the second is in CA prostate. In CA breast, usually the medicine is given to decrease the hormonal load in the body. The medicine that is given to decrease the hormonal load, that is tamoxifen or anastrozole group of medicine. Give me a minute. usually cause thickened endometrium in women. So we'll have to watch regularly for sonographies to see the uterus does not develop thickened endometrium. Otherwise, they will have bleeding. Even postmenopausal woman, 10 years post-menopause, found to have CA breast, taken hormonal therapy on tamoxifen, they have spottings, bleeding. So we'll have to give medicine. Rather than stopping the hormonal therapy, it works. Medicine like sepia, medicine like lachesis, medicine like sabina, they help in treating the side effects of hormonal therapy, which is administered to the patient. The most common side effect is, other than thickened endometrium in women, is flushes of heat. Suddenly feels hot, sweat. So you can take the detailed history. Whether the sweat is cold, whether sweat is hot, sepia comes in, lachesis comes in, belladonna comes in. So we'll have to decide which remedy it indicated and give the remedy along with the hormonal therapy to the breast cancer patient. Other side effect is mood swings, mind, so temperament, weeps, keeps weeping, then the remedies are ignatia, natrium, gets angry very easily. So there are other set of remedies which come. So all this definitely will make the patient much better in receiving and continuing the therapy which is advised to them so that they get cured of their cancer. Even after surgery, healing medicines, the way we give after biopsy. Here I've told you after biopsy, the same medicines help after surgery to heal the wound, to get the patient better, so that in 3 weeks' time post-surgery, they are ready for a chemo or a radiation. The last group is palliative, incurable cancer cases. Now, in incurable cancer cases, homeopathy has a wonderful, wonderful role to play, because the only drugs that they have is painkillers, which make them go to sleep or very, very drowsy, constipation. So by morphine, narcotic group of drugs, they give them immense nausea. So even if they are taking painkillers, and if they have immense nausea along with the painkillers to relieve their pain, bone metastasis, severe bone pain, put on morphine, develop severe nausea, give Naxomica. It will help the patient. If there is repeated fluid collection in the lungs called pleural effusion, or in the abdomen, massive ascites, which has to be tapped repeatedly, we'll give homeopathy. There I give medicines which are indicated for ascites. For example, lycopodium, apis, arsenic, give it so that the frequency to visit the hospital is reduced. The patient does not have to get tapped frequently. When the body fluids are not drained frequently, the weakness reduces, the protein is not lost in the tapped fluid, so that the patient's quality of life is better. When a patient is told that you are in terminal cancer, most of the patient, in my experience, wants to live at home. Doctor, please don't send me to the hospital. I will die peacefully at home. I don't want to go to the hospital. That's where palliative homeopathy helps. Homeopathy gives very good palliation. In fact, in integrated oncology, if a homeopath and otherpathy, like an allopath, if we become more communicative, it is very, very beneficial to the patient. If the patient has CA esophagus complete blockage, cannot eat or cannot drink anything, then we can give our medicines for weakness, for cancer of esophagus, and we can request the allopath to give saline if needed, IV glucose, IV sodium chloride at home, combination of which I don't know how much the patient survives, but the patient definitely feels better. So this is the role of homeopathy and various stages of pre-diagnosis, diagnosis, during treatment in advanced cancers. Now, what is the approach that I take when I prescribe homeopathy? So there are three approaches. It is an organ tumor we take into consideration, or we take the symptoms into consideration, or if we are very lucky and we are getting the time to take the whole history and the patient is able to give you the history, and we can come to a conclusion of a constitutional remedy. That is the best option, because not only will the constitutional remedy heal the symptoms, it will also bring the disease under control. The cancer, the abnormal multiplication will come down. Now, what are the organ remedies? You've got a patient who's just come to you, you examine, they have been diagnosed, endoscopy has been done, diagnosed to have CA stomach. What are the remedies you can think of? Kondurango, hydrestis. If you don't get much history, patient is not available for history, at least start these remedies. It will help the patient. Or if they give you a clear-cut symptom, I have nausea, I have stomach pain, I have vomiting. So whatever is indicated, either it's phosphorus, or it is Merxol, or it is graphites, or it is lycopodium, you can give the remedies which is indicated by the symptoms and relieve the patient. Here I must say that there are very wonderful remedies for organ tumors. So in fact, if you go to our repertories in Kent generalities, you will find a rubric called cancer. You will find a rubric called cancer pains. We will find tumors in which there are cauliflower-like tumors, there are ulcerative tumors. If you go in skin, there are fungoid hematodes. So all these rubrics we have to study very, very well. Those are specific remedies indicated where you do not have much mentals, much generalities like thermal state to guide us to a constitutional remedy. Because by the time, if you are in palliative case, like incurable cancer, they have taken so much of treatment that we will not get any PQRS symptom of the patient. You want fan, you don't want fan, they will tell kuch bhi hota hai chalega. I don't know how to answer you. In fact, that is also a symptom. Patient does not want to be disturbed. Patient aversion to answer. But at that point of time, when you have been troubled by so many visits, so many treatments, and in the end, you are again diagnosed as incurable, I think the frustration, the aversion to answer is quite a common mentals you find in many, many patients. So I go to, say, pleural effusion, dropsy, chest. So we need to see all those and give remedies accordingly. Symptoms also, as I told you, post-chemotherapy, post-radiation, if there are burning pains of extremities post-chemotherapy, I will think of sulfur, I will think of lycopodium, I may think of medarinum. So those are the remedies, natromure. So those are the remedies which will give relief. Constitutional remedy, one of the best remedies, if you can come to a conclusion, you will see that the patient's disease stops progressing and the survival period is also extended. Quality of survival period is extended by giving specific organ tumor remedies and symptom relief medicine. But the longevity increases when, if at all, you come to a conclusion with constitutional medicine. That is my experience. Now here, I will start with a few cases. So I'm sharing with you my experience of integrated treatment, both together. So this is a case of CA breast. There's a 62-year-old lady found to have CA breast, right breast, lumpectomy done, and surgery confirmed, biopsy confirmed, cancer. So she was prescribed about 6 chemotherapies to be taken. The moment first cycle went in, she had problems. Her daughter-in-law calls me that my mother-in-law, after the first chemotherapy, has taken ill. She has so much of nausea. We have given her all the medicines prescribed. So they would have given MSET. They gave IV MSET also at the hospital before discharging her. But she had severe nausea. She told me she's feeling so cold in this hot summer. She's taking a blanket and she is sleeping. She's sleeping because she's very, very weak. She does not even have the strength to get up and go to the bathroom. We have to support her. And this is all after chemotherapy. Before the chemotherapy, the patient used to even cook in the house. And with the chemotherapy drugs, she has a burning sensation all over the body. And in the talk on the phone, the daughter-in-law also happened to mention that she makes me close the door of her bedroom if I'm cooking. If I'm cooking, she says I get nausea. So then I gave Arsal. Within few hours of Arsal, her nausea, her severe retching decreased. She started accepting liquids. By day 3, she was 80 to 90% better. They also had prescribed an injection, which is to stimulate the WBC, which have gone down because of chemotherapy. But the patient was scared. If I take one more injection, I will again have nausea. I told her, let's do the CBC. If your WBCs are above 4,000, we won't give you the injections. If it is lower, we need to take it because you won't be receiving the next chemotherapy otherwise on time. And a delay in treatment can bring back the cancer. So when we repeated the CBC, her hemoglobin was 10 plus, which is acceptable limits to receive the next chemotherapy, which is posted after 21 days. Her WBC was 4,200. So we could prevent the injections which are a growth factor which stimulates the bone marrow to produce more WBC. Apart from the cost of that injection being saved, the patient also was relieved not to take one more injection. Of course, those injections are subcutaneous, but they do give rise to reactions like severe body pain or fever and local reaction on the skin when taken subcutaneous. See, the knowledge of all this is very, very important. I will not say don't take chemotherapy, but I can say don't take the growth hormone injections. So arsenicalb given, the moment she was relieved of her weakness, of her nausea, retching, she started eating very well within a week's time of chemotherapy. And she was ready on the 21st day to receive the next chemotherapy. So that's where integrated role of homeopathy comes in. I'll give you another case. It's a case of multiple myeloma. I got a call for giving an appointment for a 72-year-old patient, an engineer, retired engineer from the government. And I was told that please don't make the patient wait. I said, okay. Saying the patient is so much in pain, we are going to bring him on a wheelchair. And he will directly from the car come inside your cabin. I said, okay, send me the reports. When I read the reports, the patient had presented with pain in the upper spine. And on MRI, D10, dorsal 10 vertebrae had collapsed. They did the biopsy. He was diagnosed to have multiple myeloma. Initially, they gave radiation, local radiation 10 sessions, and put him on oral chemotherapy. The oral chemotherapy for multiple myelomas has to be given for 20 days a month, then 10 days gap. When oral chemotherapy is given for 20 days, steroid is also given. He was on chemotherapy. He had already taken the radiation. And because post-radiation, when they repeated the PET scan, the D10 vertebrae had completely collapsed. So they also did a repair surgery for D10. They rebuilt the D10. This was done at Hinduja Hospital, Bombay. Post-surgery, it would be about 20 days when the patient contacted me that I will come directly into the cabin. I will not wait outside even for a minute. I said, okay. And really, the patient was brought on a wheelchair. And he came into the cabin. So I asked him, why are you not able to walk? Your surgery is done in the upper spine. What is it to do with your legs? He said, doctor, the pain is so much, I cannot even bear to be touched. So from the day of radiation and surgery, he will not move his arms. His wife used to brush his teeth. He would be in lying down position. He will eat food in lying down position. He said, if I move my arms, my pain increases. If anybody comes near me also, I'm very scared. I tell my wife, you please stand a little away from me and talk to me. Don't come near me. He had severe pain in the upper spine. He's telling, I've spent so much money. I've done so many treatments, radiation, chemotherapy, surgery. But the point is, I went for my pain is still there. Doctors say I'm getting better, but my pain has not improved. How am I better? I used to walk before, I can't even walk now. So the complaints were fear of moving the arms and the affected limbs, severe pain. On these symptoms, anyway, it composed surgery, so arnica was given. Along with arnica, I also encouraged and gave confidence to the patient that I will make you stand. He was 6 foot tall. I'm 5 feet. I held both his hands. I asked him to step down from the put his feet down on the ground from the wheelchair. I helped him to get up. I told him nothing is going to break. Everything is fine. Your reports show the surgery was a success. You will be walking. You will be able to use your hands. The fear is there. That is why you're not able to move the arms. And the more you keep them steady, you don't exercise them, post-surgery physiotherapy is needed. If you don't do it, you'll have a muscle spasm and the pain will go on and on. I myself called him almost every week and taught him all the exercises of the shoulder girdle, of the neck, of the hip joints, and made him walk in my clinic. His wife used to accompany. They used to take a video of the exercises that I used to show. His wife used to make him do the same amount of exercises at home. And that man started walking within 2 to 3 weeks of arnica. He is able to lead his life normally. The pain reduced with arnica along with exercises. So that's where the integration comes. Physiotherapy plus medicine plus emotionally giving confidence to his wife and him that, look, nothing can be broken. Everything is correct. That much time you need to give to the patient. That much confidence you need to give to the patient and his family members. Today, he's with me since the last 1.5 years. He's doing well. His multiple myeloma has completely resolved. He's still taking chemotherapy and homeopathy both together. He takes walks now every day for 45 minutes. That's where we say the quality of life of cancer patient is improved. I'll go to my next patient, which is a case of CA lung. This is a very recent case that I've got. I was sent the reports by email, and there's a large mass in the right lung with massive right pleural effusion. Patient's age 88 years old. So any further investigations or treatment was not advised, looking at the age and the general condition of the patient. So when there was a large pleural effusion, so of course for diagnosis, they tapped it and it showed cancer cells. So they did not do a bronchoscopy, nothing, just on the scan and the tapped fluid seen showing cancer, positive for cancer, he was asked to go home. Within 3 days, again the breathlessness started. Again they went back to hospital. It was Global Hospital, Mumbai. So it's next to KEM. It's a very good hospital. They went there again. On X-ray, there was a massive right pleural effusion. This is within 3 days. So the doctor this time told that repeated admissions, it's very difficult to bring the patient. So we will insert a tube in the pleural space and we'll attach a bag. So whatever fluid is formed gets collected in the bag and we keep changing the bag. And we'll get the tube changed every 20 days. So with the tube in the intracostal region, I was asked to give some medicine to give relief in the breathlessness, in the cough, the fever that the patient had. I asked the patient, how is the cough? So the daughter-in-law answered me. The patient could not talk. The daughter-in-law answered me, doctor, you just have to go to his room, sit by the side. Don't even go near the patient. You enter the room and you can hear the phlegm, the rattle of going up and down. Whenever he breathes, we can hear the phlegm in the chest going up and down. And when we try to give him some food or water, when he opens his mouth, I can see the phlegm right stuck to his upper palate. I said, does not he remove the phlegm? Saying he's too weak. He cannot remove the phlegm. He coughs, but the cough is very weak to bring out the phlegm. He was being nebulized. No nebulizer helped because the phlegm was too thick, too much for the medicine even to reach the bronchus. There was high temperature, 103 degrees every evening. It used to come. And I asked him, does he need fan? So he does not need fan. He's breathless. I asked them to prop the patient up on 30 to 40 degrees, which will ease his breathing, which helped. In all this, I asked, how is your thirst? The patient answered, I want cold water, because he is used to doctors telling him, don't drink cold, don't have cold. So that indicated the remedy. Thirst for cold water with a rattling cough, profuse expectoration, unable to bring out the expectoration, fever and breathlessness. Antimony tart was given. It gave immense relief. Fever subsided within about a week's time. It came down to 100 for the next 2-3 days, 99 for the next 2-3 days. And now we have no fever since about last 15 days, there is no fever. The rattle in the cough has come down. The cough has not gone. What I have achieved here is relief, good quality life. Now the patient has started having one roti, initially only on liquids. Now he started eating little solid food. He's able to talk. He's able to sit for longer time. Otherwise was only lying down. Patient was in immense breathlessness. Now the breathlessness has decreased. We did not need to admit him again for suction. Otherwise, the next step would be to admit him for suction of all the secretion, which itself is a very painful process to be done. So in CL lung at 88 with an advanced case, I do not know how much I will cure him, but definitely every day given, if it is alleviating the symptoms, if it is decreasing the symptoms, if it is giving relief to the present symptoms, we should be happy. Even the patient is happy. So this is how we integrate homeopathy with other systems. Now, because the tube was inserted, obviously there is pleural fluid getting collected in the bag. Now, initially when we started, every day 300 ml would be collected. Now it is 50 ml to 100 ml, 100 ml to 50 ml gets collected. So even the rate of pleural fluid that is formed has come down with the medicine. This patient at 88, we don't expect to investigate further. No x-rays, no CT scans, nothing. So I'll go to my next case. It's a case of CA ovary. Now this is also a wonderful case. She is an old patient of mine. I had helped her out while treating CA breast. 15 years back, she had CA breast. She had approached me along with radiation. She did not want to take chemotherapy. That's the time she approached me and we treated her then, followed her for a period of 5 years, and then she stopped coming to me. Her son calls me from Seven Hills Hospital, Mumbai, telling that we are in the OT again. Mummy has been operated for CA right ovary. She was a diabetic and the stitches have again gaped and lot of pus is oozing out. So this is the second surgery we have done and again mummy is oozing a lot of pus. So I asked for the reports. The sonography showed an abscess below the abdominal wall and the wound had gaped. I have not even seen the patient. She was in the hospital. Again, it was cleaned, the abscess kept for a day and next day we sent back home. From the reports and talking to the patient, I gave Silesia. Silesia was given, all the pus oozed out, healing started. The wound, abdominal wound, central abdominal wound which has gaped, started healing, started joining. And the patient was relieved of repeated dressings, betadine gauze being inserted and taken out every day. All that stopped and the wound healed beautifully. This kind of relief, where repeated antibiotics were given, but and the sugar was under control. Then too, the tendency of the skin not to heal, to form pus. On this, I had given Silesia. She has taken Silesia for 15 days, wound healed. She came to the clinic. I examined the wound, examined her abdomen, and then once the wound healed completely, I stopped Silesia. Then whatever remedy was indicated, I started giving that. And today it's been 4.5 years. Patient was 72 and she's doing well. So such small things where we have to intervene, relieve the patient of the symptoms that is troubling them. Now the abscess is not cancer of ovaries, but what was troubling her when she came to me? It was the abscess. So if you give relief in that, not only the patient develops, gets good health, but also a doctor-patient relationship, the trust, the faith that they have in you develops, which is a very positive signal to their body, which itself reduces the disease load, that is the cancer load, to the body. One more case I will be discussing is a case of CA breast. This is a young girl. It is interesting, this case. When she was 33 years old, she was diagnosed to have CA right breast. At age of 33, nobody wants to take a risk. She went to the best oncologist. Surgery was done, chemotherapy given, radiation given, and she was put on hormonal block. That is the hormonal therapy. She did well for a period of about 2.5 years, where she had a reoccurrence in the left breast. Now again, left breast was removed because she said, I don't want to take a chance. I will not have a lumpectomy. Please remove the whole breast. Breast was removed, surgery done. And the type of tumor this time was not responding to the hormonal blocks. So that was stopped. But again, a second protocol of chemotherapy was given and radiation was given. So she actually came to me when she was at this stage where she was found to have cancer in the left breast. Surgery was done and she came to me with chemotherapy. So I told her, start homeopathy. She said, "Doctor, I'm very clear that I will not stop any chemotherapy or radiation. My son is only 7 years old. I need to live. My family needs me. I cannot take a chance." I said, "Understandable, fair enough." Though she had been told the same, that your tumor is curative at the first time when right breast was operated, treatment given, 2.5 years were good. After 2 years, she was being told that now there are very less chance of the tumor to come back. But you see, cancer, we cannot predict 100%. So it came back, unfortunately for her. So when she came to me, this was, I'm sure it was somewhere around June 2019. So she was with me for about 45 minutes to an hour, where at the end of it, in my clinic, she took a decision that no, I don't want homeopathy. Along with chemotherapy and radiation, my husband wanted me to meet you. So I have come, but I'm very clear. I do not want homeopathy along with chemo and radiation. I said, good enough. Again, 6 months later, her husband contacted me that we have had a bad report. After the prescribed chemotherapy, now the PET scan shows metastasis to the lungs, the lymph nodes were mediastinal, okay, right and left, both side. And bone metastasis was left iliac bones and the ribs. Lungs was right side, upper lobe lung, and it was also on the pleura. There were metastases. So this report, PET scan, was sent to me by email. And her husband told me, if you are ready to take up the case again, then I will convince my wife to come to you. So that's where we have to consciously make a decision that every patient has a right to choose to take your treatment or not take your treatment, because the disease itself is so scary. They may not be able to take the right decision when they meet you first. So I said, doesn't matter, please bring the patient. And we started homeopathy with chemotherapy that was prescribed. Again, a new protocol. After the CT scan of the left breast, after the chemotherapy of the left breast, when the disease progressed during the chemotherapy, again a new set of protocol of chemotherapy was prescribed. And they had done all the possible tests, the genetic testings, the fish tests, everything. And only then the protocol of chemotherapy was chosen. Then too, there was a progression. Once we started homeopathy, I'll tell you her symptoms when we met me. So
Hello,
the
ma'am.
symptoms were, when she met me, with the third protocol of chemotherapy that was prescribed, was pain in the left knee, aggravated initial movement. She had metastasis on the left iliac bone. The pain was aggravated initial movement. Pain was aggravated folding the leg. Pain was aggravated climbing stairs. She had redness of the left eye, pain and irritation in the left eye. She had severe bone pains. Now, this bone pains could also be due to the bone metastasis, and also post chemotherapy, most of them develop severe bone pains and fever because of low WBC count post chemotherapy. All I had is these symptoms. The lung metastasis were asymptomatic. She never had any cough. So on this, I had given her to start with. Of course, it is a long history, because every time the chemotherapy is given, I take up the symptoms again and again. This was the initial part of it. I gave Rustox. The moment I gave Rustox, within 2 days, she said, my pains are much better. My body is not aching. I can sleep in peace. Otherwise, the whole night I was turning and tossing. The fever has come down. My eye is better. My knee is yet paining, doctor, but I'm sure if my bone pains have come down, this will also get better. You see the confidence that you get with a patient when you give immediate, quick relief. That is what is needed. Right remedy chosen, right way of giving, give relief. The patient develops faith in you, your pathy, and the trust between a doctor and a patient is developed. And from then on till now, it's been about 1.5 years. or maybe a year, not 1.5 years, that the patient is with me, and the next CT scan after giving homeopathy and chemotherapy combined shows reduction in the lung metastasis, complete resolution, that is no lymph nodes in the mediastinum and no bone metastasis. Completely the bone metastasis has gone, the lymph nodes have completely resolved. What is left behind is a right upper lobe small lesion, decreased compared to the previous. She's still on homeopathy and on chemotherapy. She's posted for the next PET scan on 15th of December to see where we stand. So if I look at this patient, when she came to me, it was a severe progressive disease. Taken all the treatment, then to the disease was progressing. So from the age of 33, now she's 37. This is the first report that we have seen there is a regression in cancer, which gives a lot of hope to the patient and to me, both, that we can help her survive a good quality life for many, many years. She's only 37 years old. I'll go to my next case. Now this is my last slide, that is humanity. Where do we stand in integrated oncology? It is knowledge of medicine. Priyanka. It's knowledge of medicine, plus there is something more that I've been talking in all the various cases. Something more than knowledge of homeopathy, knowledge of cancer, knowledge of investigations, knowledge of treatment available in other areas, is a quality which every doctor, immaterial of what pathy you follow or what is your speciality, you need that quality, which is being empathetic, being a good human being, having the art of healing, medicine plus art of healing. These two combined only will give patient care. Only art of healing, only having empathy, a serious feeling, a deep feeling for the suffering of the patient, for the difficulty that she is facing, without the knowledge of medicine, is not going to. They are interrelated, they are interdependent. For us to give relief to the patient, to give good quality of life to the patient, it is very, very important that along with being a good doctor, you have to be competent. Absolutely. Your knowledge has to be perfect about the medicine that you're practicing, the knowledge of the disease, along with that, art of healing. This is forgotten. Nobody has time for the patient. I've seen many doctors handling their mobiles. Half the time we have computers in front of us, seeing, typing the symptoms, coming to the remedy. I don't have a computer in my cabin where I examine the patient. I don't. My 100% time, eye contact with the patient is there. I listen to the patient. Hearing and listening, two different aspects. You have to listen to your patient. And you don't know, while listening to the patient, you may guide a symptom which will guide you to the remedy. Give time to your patient. This art of healing, that is being empathetic towards the patient, listening to the patient, making the patient comfortable, counseling your patient, teaching them how to do pranayama, teaching them how to do exercise, along with medicine, develops a trust, a faith between a doctor and the patient. And in that starts the healing process. It has to. If the mind is happy, the vital force will be stimulated. You will help the vital force to overcome the disease force. And you have seen in most of my patients, I have talk to you about patients, only one young patient of 33. All other patients, where one was of 72, one was 88-year-old. So these patients who are already very weak, they are aged, they need attention. If they are told, the anxieties that they develop when they're diagnosed to have cancer, fear of going even to the hospital is there in them. If you try and talk to them nicely, listen to them, be a good human being along with being a doctor, you will definitely achieve cure. That's my request to you, to be a good human being along with being a good doctor, to help any patient of any disease. Thank you. Yes, Dr. Deepu?
Ma'am, there are some doubts in the chat box regarding the potency actually. Ma'am, I think you are muted. Can you unmute your?
Yes.
Yes, yes. Ma'am, there are some questions regarding potency actually for the from the for the cases which you presented.
Yes, please.
Potency and repetition.
According to me, I've been practicing for the last 26 years in oncology. And my sincere advice would be, first, you start practicing with an oncologist, know the severity, or have a good understanding of the disease. And if in your experience, what is it that gives you relief? If you ask me, potency, repetition, achieving cure, I've given you initial examples. That's not the only remedy that I've given during the case. I told you the symptom goes away, the remedy goes away. New symptoms arise, again I retake the case. If the same remedy is indicated, I give the same remedy or I change the remedies. What is present will be healing the patient. So potency also is my experience, which I would, it takes long years of experience to give that. So it takes a long time to understand how to give potency, which potency, what is the repetition. It takes a real long time to understand that, and it is not right for me to tell you right now, because otherwise you will be dealing with cases, rather than helping them, you'll be spoiling them.
Okay. About immunotherapy.
Yes. You ask me about immunotherapy.
Yeah, yeah.
In what way? In what immunotherapy you want to give?
Okay, okay. Dr.
Please.
Maheshwari,
Huh.
can you please elaborate the question? Okay.
Yes, please. Please. What is immunotherapy? What do you mean by immunotherapy?
Okay, okay. Please share some organopathic cancer remedies.
Yes, I will do that. So, if it is a hard tumor in the breast, it would be conium. If this tumor is just touching the skin and the skin is roughened, almost ready to ulcerate, it could be Asteria rubens. If there is severe pain with hard tumor in the breast, it could be phytoleca. It is going to be, as I told you, if there are severe cuts at the corner of the lips with stomach cancer, I would give Condorongo. If there is very sticky saliva and the patient has been diagnosed or query could have cancer of the esophagus lower end or of stomach, telling that I have difficulty in swallowing or I have pain in the abdomen, weight loss, then I will give Hydrestis. Hydrestis also has a beautiful symptom of no desire to live. So if I get a mental symptom, I'm definitely, I will look out. I'll look out for all the symptoms. For example, if you have rectal cancer, you think of Ruta. You have um, uh, cervical cancer, you can think of ulcerative remedies. So there are so many remedies. You just have to apply. You can think of Bediaga in Hodgkin's, Calimure in Hodgkin's, calcareous iodide in Hodgkin's, or I mean lymphomas. You can, in leukemias, you can think of natrum sulf, you can think of lacases. In liver cancers, you can think of lacases, Crotalus horridus. So there are so many remedies.
Okay. So any more doubts, dear doctors? Okay, I think there are no more doubts. I think which
Okay.
medicines post biopsy
So
medicines?
what would you, I want an answer from you guys. Now, what remedy do you give a post biopsy? Please tell me in the chat box.
Yeah.
You tell me. And I've indicated healing remedies.
Yes, I
What
think
would that be?
yes,
Come
yes.
on. If you've heard me, you'll come to know.
There
Yes,
are
ledum,
harnic.
ledum, arnica. Absolutely bang on. Correct. Absolutely correct. Absolutely correct. Absolutely correct. You all know it. We just have to give it.
Yes, you are giving medicines with chemotherapy. Yes, I think.
That is my chapter today is integrated. Integrated means hands in hand with other pathy. Correct?
Yes, yes, yes.
Yes.
Okay. I think
Calendula, yes, very good remedy for healing.
okay. For blood cancer, somebody asked me.
It is there, leukemia, search for the rubric.
Yes, 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 yes. Actually,
Yes.
numbness after chemotherapy.
Numbness after chemotherapy, gnephallium, if there is pain, there is rust ox, there is sulfur, there is sorenum, lycopodium, silesia. So other
Uh,
things have to be taken
Yeah, I
also.
will give you Dr. Raman Rao. I will give ma'am's contact definitely. Single dose or repetitive
Again, a
dose?
very difficult question to answer in one session.
Yes, yes,
Again, it
yes,
comes back to
yes.
potency repetition. Again, it comes remedy also. You think it's very easy, but it's very difficult. You'll have to pay complete attention when you take the case taking. You have to differentiate the remedies and give the indicated remedy.
Yes, yes. I think, yeah. Mm, most frequently used potency for ma'am in your practice.
Would not be able to disclose unless there is a series of session, which I'm very confident. It's over the years that I've learned to do this.
Okay, please explain about Wilson tumor. Please explain about Wilson's tumor, I think.
I'm explaining about integrated.
Yeah, yeah.
Stick to the subject. I can talk on oncology,
Yes, yes.
completely new subject. I treat only patients with homeopathy. So please stick.
Okay, so dear doctors, I will share the number of ma'am in this lecture. I will include that. So you can have your doubts, queries directly to ma'am. So that's for today. Actually, this was a wonderful session which we planned last month, and some delay happened, and it just happened now. We will definitely comes up with another session soon. Not soon, but we'll come up with another session. So thank you, ma'am, for joining us on behalf of IHMA Piravam. We
Thank you
express
so much.
our sincere gratitude to you, ma'am,
Thank
and
you.
to all the doctors who are continuously supporting us. There are more than 75 people today,
Thank
and there
you.
are more than 100 people in YouTube as well. Thank
Thank
you
you, sir.
all for
Thank
your
you.
constant support. So bye, bye. Thank you.